Yeah, thank you so much for joining. It is somehow February 2026, so we're here for our second Lunch and Learn of our series. This month's Lunch and Learn is going to cover some really great topics about advocacy, some of the current and upcoming bills in the state, and how they can or may affect families and children. So, we're going to have a number of speakers joining us. We will share their information at the end of the presentation so that if you have questions or more specific things that you'd like to ask them, you can get that information. Please consider joining us for next month's Lunch and Learn, which will cover our adaptive strategic plan, which is launching very, very soon. We're really excited to share that with all of you. Registration information for that session will be shared in the follow-up email, which will come again normally around the end of the week. So for those of you that do not know me yet, my name is Tara Palladino, and I am one of the training and program managers here at the New Hampshire Children's Trust. I'm going to be going over some of our agenda items, our housekeeping today, and then I'm going to pass it off to my colleague, Nicole, who I'll introduce later, who will be moderating and supporting our wonderful panelists as we go. I do also want to call out too, we have our funding statement at the top and bottom of the presentation, but our Lunch and Learn series and our Family Support New Hampshire activities are supported by our CBCAP grant, which is community-based child abuse prevention. And so we are funding a number of activities through that and are just very appreciative to be able to bring that to you today. So just general housekeeping reminders. When you're able, please keep your cameras on. Keep your microphone muted through the presentation as you can. If you have questions, please submit them through the chat function. We will get to them during the Q&A portion, and we want to make sure that there's time for that. So as you think of things, please jot them down and know that we will answer those as we go. Anything that maybe needs more time or information, again, put it in the chat and we will send those to the advocates for further follow-up after. And then we will send some post-session feedback, surveys, and additional resources out following the session. Great. And so quick agenda. As we said, right now, we're just putting names, organizations, and your real feel temperature in the chat. We're going to go through one more quick slide for our housekeeping, move into our presentation, have some Q&A, do a little bit of resource sharing. It will be abbreviated today from last month, session. So if you have any upcoming events, resources, anything that you found lately at your organization that has supported the families and children that you serve, please keep those in mind and share those out later on in the session. And then at the very end, we will end with what is hopefully some people's favorite, our summit raffle and wrap up. And so just as a reminder, we will be raffling off a ticket to our Strengthening Families Summit, which will be held in November this year. And that will go to one lucky participant today who registered for the call. Awesome. And so the last update from me here at the top of the call, like I said, it's somehow already February, which means it's somehow already almost April. And so as many of you may know, April is Child Abuse Prevention Month. And so one of our many initiatives for that month is our pinwheel gardens. So you've likely seen those across the state. I know a number of you here already have partnered with us in the past on that. For those of you that have not or who have but haven't confirmed their interest this year, please consider joining us. It's a free initiative. We just need to know that you're interested, and we will send you pinwheels and yard signs to put out and display to just have really visible awareness across the state in support of Child Abuse Prevention Month. So if you're interested, please contact my colleague Jen by the end of the week here. It is a tight turnaround, so please do your best to get that in, but we will kind of be on the lookout if you need a couple more days. I'll put Jen's email in our chat box as well, so you'll have that there. And then, like I mentioned, my wonderful colleague, Nicole Heller, will be moderating today's session. So Nicole is our Senior Director of Programs and Impact at the New Hampshire Children's Trust, and I'm going to let her take it away.
Thank you so much, Tara. And Tara, if you can I think we have some folks in the waiting room, if you don't mind letting them in. We have people who are actually over with the legislature as we speak, and so they are coming in right now. So I'm so excited to talk about bills and advocacy today. A little bit of trivia in case you aren't up on your legislative numbers, we have 424 legislators in our state, which is super cool. It means you can't throw a rock without hitting one. It also means they're super accessible and we can talk to them. We are also the third largest English speaking legislative body in the world. The UK Commons is the biggest, US Congress, and then New Hampshire State Senate and House. So enjoy that. They are citizen legislators. They get paid $100 a year in mileage to Concord. So I say all this to say over 1,000 bills come through New Hampshire's state legislature every year, and they talk about every single one of them. It is really hard to stay up on all of these as a typical Granite Stater while we're also doing our jobs, taking care of our families, taking care of ourselves. And so today we wanted to highlight some of the bills that may impact children, families, and your organizations the most so that if you're compelled, you can take some action on these and follow them. So we have 5 panelists today who are going to discuss these bills. And I've got a lot to cover. They've got a lot to cover. So I'm going to stop talking. I want to highlight them. My panelists, if you could introduce yourselves, your role, your organization, and maybe the 20-second version elevator pitch of what your organization does, that would be beautiful. I'm going to start with Joe Porter because you're first on my screen. Take it away.
Thank you. Thanks, everybody, so much. So my name is Joe Porter. I'm the Chief Strategy Officer at the New Hampshire Center for Justice and Equity. We are a statewide nonprofit organization housed in Manchester, New Hampshire. Our mission is to elevate and empower people of color in New Hampshire by fostering connections, changing systems, and meeting community needs to make the Granite State a place where we all belong.
Thanks, Joe. Kenz, can you go next, please?
Hi, everyone. I'm Mackenzie or Kenz Nicholson, she, her, co-senior director at MomsRising. We are a grassroots advocacy organization focused on making New Hampshire and the country a better place for moms.
Thank you so much. And my Waypoint friends, Liz and Emily, can you introduce yourselves?
Sure. Hi, everyone. Oh, go ahead, Liz.
Go ahead, Emily.
I'm Emily Lawrence. I'm the advocacy director with Waypoint, and Waypoint is a statewide nonprofit organization that provides services from birth to death. And we provide an array of human services and also advocacy, which is what Liz and I do.
And I'm Liz Balsito. I work with Emily as an early childhood advocate in the advocacy department.
Thank you all. And I will highlight, we also have folks from New Futures joining us. They're some of the folks that are over at Granite Place right now working in some of the hearings, but they will be joining us in a bit. We also have some slides from Save the Children's Action Network. Their director couldn't join us today, but we wanted to be sure to pass along their messaging. So Tara, if we can get those slides back, and I believe we are starting again with you, Joe.
I think so. So thank you, everybody. So I'm, there are a number of bills that we're watching, as Nicole said. We could probably spend an entire hour talking about all of the ones that we're watching. I'm going to take us up just maybe a level to talk about some of the sort of tenor and tone that we're seeing through some of these bills, and kind of leave the sort of ECE specific and childhood specific bills to some of my colleagues. But to give you all a sense of some of the things that we're watching and trying to thread that needle a little bit for why we think these things may be important to you all as well. If you could just hit the next slide, Tara. I'm just going to go through 3 of them pretty quickly. So the first one that I want to talk about is HB 1788. And the titling is Holding State Contracts with DEI Provisions to be Void as a Matter of Law. Ooh, there's a typo, sorry, matter of law, and establishing a right of action for taxpayer where their public entities or state agencies engage with contracts with DEI provisions. So this particular bill addresses kind of an extension of some language that we saw go into HB2, the House Bill 2, which is the budget bill. In the last session, kind of in the, I'll try to do very little commentary, but not through the traditional legislative process. We saw some text get added to our budget bill that prevented any contracting or any programming with diversity, equity, or inclusion included in it. And so it didn't have a public hearing. It didn't have an opportunity for folks to really address some of the issues that are prevalent when we talk about sweeping, not very well defined prohibitions on activities related to anything, particularly around diversity, equity, and inclusion. And so that HB2 bill resulted in a lawsuit. That lawsuit resulted in a preliminary injunction, enjoining most of that DEI provision from coming into play. And this bill kind of takes the next step of that and tries to sort of reiterate that the state's money and public money should not be used for anything that's deemed DEI. The problem that we're running into in this bill is that we don't really know what diversity, equity, and inclusion means in the eyes of the folks who are trying to interpret this law. And if it's passed, creates sort of a chilling effect on the kinds of things that you might want to do to address different needs for different populations. And so one of the reasons we're watching this is when we look at some of the things that any entity that's receiving public dollars at all, so that might be not just state dollars, but municipal dollars as well. So if you as a childcare provider are doing anything at the local level for which you have any relationship to municipal agencies, school districts, the state departments of education, health and human services, et cetera, all of that is at risk. And so we've been watching this bill very closely and trying to ensure that when there's this sort of lack of an understanding of what does this really mean, that doesn't become law, because then it becomes really hard to figure out what you're allowed to do and not allowed to do. The other thing that I just want to call out on this is this private right of action is something that we're seeing in some legislation, and it'll be showing up again in a minute when I talk about another one of these bills. But essentially what this tries to do is say if anybody in the public thinks that they're seeing something that runs afoul of this law, it gives them the ability to sue. And they can sue the state or they can sue municipalities, and both the state and the municipalities are then kind of tied up in litigation against individual suits coming from the public, where somebody says, I don't really like what that person did, I can now sue them for it. So this private right of action is a little bit challenging for folks, and to understand how that could have implications in a number of places, municipal and state being among them. Another bill that we're watching pretty closely is HB 392, which dissolves the Department of Health and Human Services Office of Health Access, which used to be known as the Office of Health Equity, and the Department of Environmental Services functions for environmental justice. Again, one of the reasons that this one becomes really important is that a lot of the accessibility parameters that people rely on to receive services exist within this Department of what is now Health Access. So things like services for hearing impaired folks, people who have visual needs, a variety of different services are wrapped into this Health Equity Office and this Health Access Office. And while the bill makes some indication that those would all be housed in different places, exactly what that means is a little unclear, and how it would happen is even more unclear. And one of the things, again, when we sort of think about those of you in this space, to the extent that the Health and Human Services Office has contracting ability to have specialized services for individual needs, some of that could be at risk if this department goes away. So we're watching pretty closely on the dissolution of HHS's Office of Health Access, and then some of the environmental justice parameters from the Department of Environmental Services. And then the last one that I'll bring forward really quickly, because I know we got to get to my friends on this call who have really important bills to talk about also, is 1792. And 1792 is prohibiting school districts from the instruction of certain, quote, and I quote, revolutionary leftist indoctrination. And so there are these wide sweeping, not defined concepts that are not permissible for teaching underneath this bill, and how far that extends to folks who may be receiving state or public dollars in any way, not just sort of quote unquote public education in schools, because schools is a broad definition in this legislation as well. This could have some really important implications for what is teachable and not teachable, and at what level. in the schools and in anybody that's sort of under this broad definition of schools, which might go broader than you might think from a K through 12 education setting. And so again, this has some pretty sweeping chilling effect on what people might want to be talking about in classrooms and what they think that what they're safe to talk about and how they're safe to talk about certain things. If you're a teacher, for example, or a curriculum designer as another example. And I just want to call out before I hand it over to some of our friends that this bill, like 1788, also has a private right of action for violations. So again, this additional space where somebody in the public, if they say, oh, I think that school's teaching the things that they're not supposed to be teaching, has an ability to bring a complaint against the schools and the instructors, and also the potential of a civil action. So the implications for this are pretty broad as well, and it's really unclear because there's so much nebulous language being used without strict definitions how sweeping some of these might be. And that's kind of a theme, is sort of sweeping not well-defined concepts and these private rights of action that we're pretty concerned about as we watch this session.
Thank you so much, Joe. So I'm taking from this that because there's widespread and things aren't defined clearly, that it can create some uncertainty if the laws are passed, and extra work for our state departments as they try to figure out, how do we enact this? How do we enforce this? How does this work?
Correct. And similar legislation in previous sessions has brought these lawsuits that also then tie up resources, as the state's gotten sued multiple times to prevent some of these laws from becoming action. And again, in a resource-strapped environment, knowingly putting something forward that is likely to tie up the resources in other places just seems like really bad policy.
Sure. Thank you so much, Joe.
Sure.
And for our audience, I encourage you, we're going to do questions at the end, so everyone has time to go through their slides. Please drop those in the chat. Tara and I are going to monitor those, and we'll make sure that we get to them before we depart together today. All right, so next on my list, I have Ken's from MomsRising. And Ken's, you have some important concepts in here, like inexpedient to legislate, dead, for example, which is an official status for bills. If you could just quickly explain what those are as you go through, so that we can kind of understand where these bills are and what that means. But I'll stop. Ken's, you take over.
Yeah, no, thanks. Happy to. And hey, everyone, it's good to see you today. I was giggling when you came to my slide because I'm pretty sure Tara asked us to cover one or two bills, and I think there's like 5 or 6 here. So apologies. I'll talk fast, but I promise to make it really accessible. So let's get into it. MomsRising, it cares about policies that affect families and moms, right? And therefore it impacts our kids. And one of the things that Kelly Ayotte said in her State of the State the other day was that outcomes matter more than anything. And so if we're thinking about outcomes, we should be thinking about, their moms and where some of that starts. So this year we had a fantastic bill, that's all sarcasm, House Bill 1250, that would have rolled back a piece of Momnibus 2.0 that we just won last year. It had just taken effect on January 1st. That protected time away from your job up to 25 hours a year to attend postpartum or pediatric appointments. The bill would have also required 15 days notice to take any time like this. And you all know that sick babies don't give 15 days notice. And, the most vulnerable time in a family's life is arguably that first year, where there are many doctor's appointments and things come up, right? Postpartum can't be planned all the time. So anyways, this bill had one sponsor, Representative Ross Berry from Ware, New Hampshire. And that goes to show you how much support there was for the bill. It went through its first committee hearing and came out of that committee with an inexpedient to legislate recommendation, which is that ITL recommendation. And then subsequently, because of that recommendation, went to the full House floor where it died because it was on the consent calendar, which meant that everybody on that committee was in agreement that it should die. So in a package of legislation all at once. The House took a vote on a bunch of legislation and this was included in it. So it's dead, which is great news because we know that families need to be able to take that time and not risk their jobs because that's their livelihood. And it means that, protected time that, you risk your job to take isn't really protected time. And that's just asking folks to be fearful of taking that time. So I digress. I said I would go fast. I'm not doing well. Then we've got House Bill 1798. This is Medicaid coverage of diapers for 1 year. That is on mom's Medicaid because it's a smaller population of moms who are on Medicaid than children who are on Medicaid. We had to kind of control some costs there. So that's unfortunate, but it did have its first House floor vote, or rather its first committee vote last week or the week before. It came out of that committee with a not great recommendation. So on party lines, the committee voted an expedient to legislate, which is that ITL, which means they don't believe it should move forward. And then it's going to be on the full House floor on Thursday. So we've got an action alert that we're sending out to our members tonight about that bill. And we all know diapers are expensive, right? And for families to utilize childcare, most childcares require that they send diapers with them. One of the things I heard in committee, one of the lawmakers said, we have diaper banks all over the state, and I've seen them have piles of diapers. There must be no diaper need. Well, I hate to break it to that lawmaker, but a pile of diapers one time at a diaper bank does not mean that families can reliably access diapers. So we've also got a paid leave bill this year. So there's some context required here, but essentially New Hampshire does have a paid family medical leave program. It's not great. I could go on for days, but last year our legislature tried to repeal the entire thing. When they were trying to cut budgets, cut back, they figured paid leave is one of the great ways to cut it. And we were able to stop them from cutting the whole program, but they did get rid of the marketing and outreach budget for the program. So we're in a legislature right now that we know is not friendly to paid leave. This year we had a Representative Paige Boschman from Nashua put forth this universal paid leave program bill, which I love the idea of. And we know the same legislature that tried to kill it last year it's the same people. And as advocates, it's sometimes hard because sometimes you just want them to forget that the paid leave program exists so that they don't attack it. And, it's a challenge with this legislature right now. So one of the tactics that we took was to ask the committee to study paid leave. And so it has this recommendation of interim study. I'll tell you that most folks know that in the second year of the legislature, interim study basically means that the bill is dead. The legislature likely isn't going to study it, but it's an important distinction because it tells the legislature that people are still thinking about this, and paid leave is critical for families who are going through, not just folks who take parental leave, right? But for anybody who needs medical leave, these things come up at all, in all times of our lives. So interim study sucks, but at least, it's not fully dead and it's signaling to the legislature that we really care. I'll just move a little bit quicker. Senate Bill 468 increases who's eligible for the Child Care Scholarship Program. And it's a really interesting bill because it's one of the only child care bills I've ever seen that explicitly ties child care and our child care scholarship system to dedicated state revenue. It did that through a braided fund of sin taxes, so tobacco, alcohol, beer, lottery. Don't, have your feelings about that, but it's really interesting that, folks are talking about ways to increase funding to childcare because many folks know that market supply and demand map for childcare doesn't work out and that families end up covering the costs of tuition, which is just arguably so expensive. And we know from great NHFPI data, the cost of care is just so bad. Then lastly, we can't do anything because we have no money. But our legislature continues to cut taxes for wealthy individuals and corporations. And we've got a holdover bill from 2025 that would reduce our business enterprise tax, resulting in a $26 million loss per year. I'll remind folks that we cut $51 million from DHHS in back of the budget cuts last year. So why are they doing this? It signals to me that they care a lot more about wealthy people and corporations than they do about us. And I'll kick it over to someone else who is more positive, maybe.
Well,
Thanks, y'all.
we'll do our best on leaving on a sunnier note. Ken's, just want to follow up quickly. What does it mean when something's waiting in exec for like a Senate committee? Can you just unpack that briefly?
Yeah, so a bill will have a public hearing where folks kind of come testify, show their support or opposition to a bill, and then that sort of segment of the bill action is done. And then the committee comes back to discuss the bill, potentially look at amendments, and then they make their recommendation, and that's an executive session. And so we're waiting for example, the Senate Bill 645. Thank you, Alyssa. Not 648, 468. Some dyslexia got to us there. We'll follow up with an edit. But anyways, I forgot what I was saying. That one, waiting for executive session, waiting for a recommendation. So all that to say that I think like big picture is that, if we're thinking about outcomes, I'm not so sure this legislature is doing the best job at grounding us in great outcomes for families and kids.
Thanks for unpacking all of that, Ken's. And you hit on a sweeping set of topics, and I really value that. Particularly, I've come out of the budget policy wonk space, and so talking about tax reductions just in general affects all services. When we're thinking about education, childcare, what can DHHS offer? And so thinking about the connection between tax reductions and boots on the ground and what that means is important. So next, I want to turn it over to Trina Inglefinger, who is another colleague who's over at Granite Place in some hearings, to talk a little bit about the work that she and her colleagues do at New Futures and some of the bills that they are following. So Trina, want to make sure we've got you here. There you are. Hello, friend. Go ahead, take it away.
Awesome. Thank you so much. Wonderful to be here. And I'm Trina Inglefinger. I'm the Early Care and Education Policy Director at New Futures. And my focus is on policies that build access to affordable, high-quality childcare in New Hampshire. And New Futures' mission in general is to address issues of health and well-being through policy change and also through civic empowerment. So I'll talk a little bit about both of those. If you don't mind advancing to the next slide, please, that would be awesome. Thank you. So on the policy change side of our work, the bill that I want to discuss with you today is SB 608, which is the Caregivers Bill. And so as it pertains to childcare, I'll just give the background that our federal childcare grant that helps fund our childcare scholarship program allows the state to provide some extra supports for kinship caregivers. And those are people who have stepped up to care for children whose parents are unable to care for them. And SB 608 would essentially take advantage of those federal supports. It would relieve kinship caregivers of the out-of-pocket cost share they might be otherwise required to pay for childcare. And importantly, it would relieve retired caregivers over the age of 67 of having to return to work or enroll in school in order to qualify for the child care scholarship. And right now, the child care scholarship is actually the only subsidy program in the state that doesn't have an age cap for its work requirement. And so SB 608 would change that. SB 608 would also improve trauma-informed training that child care providers have available to them under our state's protective and preventive child care program. It would make that training free to providers, and it would ensure that it's evidence-based. And finally, SB 608 adds some support options for family caregivers who are caring for adults with serious health conditions under certain Medicaid waiver programs. And I can point you to our Healthy Aging Policy Director, Judith Jones, for more information about that if anyone's interested. So as of this week, SB 608 has passed through the Senate Health and Human Services Committee and the full Senate floor, and will be traveling to the Senate Finance Committee, we think actually this afternoon. So we will have updates to share on that bill probably pretty soon. If you don't mind advancing to the next slide, thank you. I will also just talk a little bit about the civic empowerment side of our work and about how anyone watching this webinar can get involved in any of the legislative bills we have talked about today. So one thing that you can do is testify at a hearing. And we suggest preparing bullet points and sharing print copies of those with committee members. You can also call your legislator, find out who your senator or representative is, and call them with a concise message about your interests on any piece of legislation. You can use social media to promote or protest a bill. And you can also remotely sign in to support or oppose a bill, which is something that sort of emerged during COVID. But it's really nice because anyone can, from their computer, voice an opinion about a bill. So the last slide is just a few other options for folks if you have a little bit more time. You can always write a letter to the editor or an op-ed about the legislation that you have an interest in. And New Futures and really any of the other organizations speaking with you here today are happy to help frame out what you want to say if you want a little assistance with that. You can email your legislator with a personal message, and you can also submit written testimony to the House or Senate on any bill that they're considering. So lots of ways to get involved. And if you want to get involved in that caregivers bill, you can email the Senate Finance Committee today and tell them your thoughts on that.
Thank you so much, Trina, and really appreciate you coming out and the work that you're doing over at Granite Place today. I know you're back and forth a bunch, so we appreciate that here that you could come join us.
Thank you so much. Really awesome to be here.
Awesome. Awesome. So I know we're tight on time, so we're gonna move right over to Liz and Emily with Waypoint. They're gonna give us a little bit of information about a child care workforce bill, as well as parts of Medicaid legislation that is being considered.
So thank you. I'm going to start off and talk a little bit about childcare, and then I'll let Emily dig into Medicaid, and I'll give her the portion of our time because as big as childcare is, Medicaid is a little bit more. So if you'd go on to the next slide. So in this slide, I just wanted to set a little bit of context. Our friends at the Early Childhood Education Research Consortium at UNH put together these slides, and this is just to illustrate why childcare workforce is one of the bills that we're focusing on at Waypoint, and really trying to drill home the point of why what is going on with the business of childcare and why workforce is such a keystone in that. So when you're looking at this, you look on the left-hand side, and both of these graphs are data taken from 3 programs within New Hampshire, and this is looking at their financial statements, their budgets. So on the left-hand side, you're going to see that the majority of the revenue is either in dark blue or orange. And that is parent tuition. And it's either parent tuition paid directly from families, or the orange represents subsidized tuition through the Child Care Scholarship Program. So by far, child care programs are getting money through tuition. And then on the right-hand side, you'll see the biggest cost that childcare providers are paying are staff. And it makes sense, right? If childcare providers are paying for kids and you can't just pile children into space and say, okay, they're good. You have to make sure that there are so many qualified and cared for staff taking care of each of those kids according to the ratios with their age groups. Now, when looking at this, one thing to really keep in mind is that those childcare providers, the staff are getting paid about $15 to $18 an hour. They're not really getting paid a living wage. So even though all of that revenue is going towards staff, they're still really not getting paid very well. So if we do want to raise that staff and raise wages, we're stuck doing it on the backs of parents right now with our current system. So to try to remedy that are some legislation coming through. You go on to the next slide, please. So there are 3 bills right now that deal directly with the childcare workforce. And those are, there's one bill in the House that is a little bit more active. That's HB 66. And there's an identical bill in the Senate, SB 483. And both of those bills are asking the legislature to allocate dollars to fund an existing grant program. The program was started in 2023, and it was a program funded with $15 million that went directly out to any licensed child care program that was enrolled in the scholarship program and to potentially accept scholarship kids. And those programs receive those grant dollars to support staffing, retention, and recruitment costs. These 2 bills right now are sitting within their respective finance committees, and those committees are trying to identify whether there are potentially federal dollars that could supply grants that supply the dollars for those grant programs or state funds. And to just try to through line with all of that, what we're looking at is, holy mackerel, we have a childcare crisis. We really have a childcare crisis. And we can see that investing in childcare workforce is probably one of the best ways to do that. But we don't have the state funds to do that. And we're potentially even repealing more state revenue that Ken was talking about. So that's a real push and pull right now. We're seeing our legislature really going, we need to do something around the childcare crisis, but we're not sure we have the dollars to do that. And that's the heat of the discussion. That last bill there, HB 1515, is an attempt to just pull back that grant program and other expansions in the child care program that really is coming from the lens of government, reducing government investment in social services. So that's the long and short of the child care workforce and retention grant. And I'll pass it on to Emily to talk a little bit more about the Medicaid.
Great, thanks, Liz. So I'm going to talk a very little bit about Medicaid because I know we're short on time and also because we could really talk forever about Medicaid. But I want to highlight a couple of changes that have happened in the last year that are going to be rolling out. And what's complicated about Medicaid and right now in New Hampshire is that New Hampshire made some changes and then the federal government, the feds made some changes and they weren't always the same. So I'll kind of highlight that and let you know how things are playing out. First, I want to talk about Medicaid expansion. So those are individuals earning above 100% of the federal poverty level. They are going to get premiums or co-pays. I think we refer to it as premiums in New Hampshire, and the federal is co-pays. And also they're going to have work requirements, which will be something new. And I'll go into the specifics of that. And also the slides have a little bit more information, so you can look at those on your own time and reach out with any questions. But those work requirements are also going to require people to show their eligibility more often than had previously been done. So that's from 12 months down to 6 months. So you'll have to show that you're eligible, and that is not always an easy task. So that is going to be challenging for people. And then the other category of changes was to the Children's Health Insurance Plan, so the CHIP program. That also
put on premiums. And so that was for children in Medicaid with a household income at or above 255% of the poverty level. Can you go to the next slide, please, Nicole? Thank you. So these next two slides are courtesy of the Medicaid Matters Coalition, and I get the pleasure of working with everyone who's presented here today, and New Futures put these together. So I'm grateful to New Futures for sharing them and letting us use them. This slide talks a little bit more about the premium, just gives you an idea of what the cost will be. So for the CHIP program, families with children enrolled in CHIP earning certain incomes will pay between $190 to $270 per month based on their family size. And then individuals enrolled in Medicaid expansion, which is also known as the Granite Advantage Healthcare Program, earning incomes of a certain level will pay between $60 to $100 per month based on their family size. And you can see those income levels down at the bottom, 255% of the federal poverty level for CHIP and 100% of the federal poverty level and above for the Medicaid expansion people. The CHIP program is set to start in March for the state, but that's where the confusion comes in because the federal government passed the One Big Beautiful Bill in July, which had co-pays, is what they called them. And it is unclear to the state whether they can charge premiums when the federal government has put out the bill for co-pays. And will they be charging premiums and co-pays, which we're really hoping that's not going to be happening. But the state is trying to figure out what they can do. So it is unlikely that it will start right at the beginning of March because they're still waiting to hear. They've asked the federal government, hey, what can we do here? Can we do this? Can we charge the premiums? Do we have to charge the co-pays because that's the federal law? Or maybe they would do both, which I think is the least likely option, I'm going to hope. So that is set to start in March, but will likely be a little delayed. July 1st of 2026 for Medicaid expansion, which may also be slightly delayed, but we'll see, just because some of those changes they're looking at with the federal bill as well. Can you go to the next slide? Okay, this is the second part that changed. This was work requirements. So under the state law, I'm going to start with that first, just because the state passed their law first. Recipients would need to engage in or work in other approved activities, like community activities, for at least 100 hours each month. So that's about 25 hours per week. There are some exempt groups here from the state's perspective, and so those people would be exempt from that requirement. This is for, again, the Granite Advantage program, the Medicaid expansion. So that's for the people that are 9 to 64 years old who get Medicaid expansion. Now, after the state changed the law, the federal government, the feds legislation changed the law, and they only required 80 hours each month to keep their health insurance. So what's happening right now in New Hampshire is that, and if you want to go to the next slide, Nicole, I can talk a little bit about that, is that we have a couple of bills, including Senate Bill 134, which is looking to, it was originally brought last year to bring this work requirement into play, and then the work requirement was put into HB2, which is the budget, and that's a whole other complicated process, but that's how it got passed. But that means that Senate Bill 134 didn't go through the whole process, so it was still kind of alive, so to speak. And what they've done with it now is to amend it so that it is pretty much in compliance with the federal law. So that would mean that New Hampshire would go to 80 hours, and some of the other changes would be in alignment with the federal law as well. And they would really just suspend the state law for the period of time that the federal law is in effect. So that means that if the federal law were ever to change or to go away, then they would have the state law come into play, and that would go back to the 100 hours. That bill has passed the House and the Senate, and so now it is headed to the governor's desk to see if she will sign that bill. There is another bill, Senate Bill 506, which is very similar to Senate Bill 134. They kind of brought that as an extra bill to make sure they could get these done if Senate Bill 134 had problems. And it will likely just be held and to see if the governor signs 134. And if she does, then this bill will likely be what they call ITL, which Ken's talked about. So those are the biggest changes around Medicaid. And we're still seeing when those are going to roll out because our dates were a little bit different from the federal dates. And so that is also what the state is trying to figure out how that will happen. And in one of the slides, you don't have to go yet, but you can look at this on your own. We do have like a time frame for it. So you can take a look at that and see when everything is supposed to roll out if it were to roll out by the bills. A couple other bills, Senate Bill 484 and House Bill 1760, they are almost identical bills that were brought, one on the House and one on the Senate side, to seeking to repeal those premiums and to limit, oh, we have a spelling error too, the Medicaid expansion cost sharing. So Senate Bill 484 has been heard. And House Bill 1760 has not yet been heard. So that will be heard probably very soon. It is unlikely that those will pass because unfortunately they were brought by a number of Democrats and the Democrats do not have the majority right now. And so because the Democrats opposed the premiums when they were put into play last year, but because they didn't have the majority, the premiums passed, and that will likely happen again with these bills. House Bill 1794 is another bill that would direct the Department of Health and Human Services to really look at and identify the impact of the Medicaid changes on New Hampshire residents' access to health care. That bill was also brought by a number of Democrats, so we're not quite sure what will happen with that bill, but it is a little bit more likely to pass than the repeal of the premiums. And then finally, I was going to cover House Bill 1798 around the coverage for diapers, but Mackenzie already covered that, so we can move on. And we did label at the bottom, it's HR 1, or otherwise known as the One Big Beautiful Bill, and that was what brought all the federal changes. If you want to go to the next slide. So I'm not going to go through this. You can look at this on your own. This is the timeline of all the changes. And someone at New Futures sat down and put this together. So really kudos to them for parsing through everything and looking at it. Some of these things are likely to change. So unfortunately, just keep that in mind. But you can always reach out to anyone probably here and ask a question and we can get back to you. Next one, I think we're pretty much wrapping up. Oh, just some resources. So the Medicaid Matters Coalition has a lot of resources on its website. I can put that in the chat. And they're also having a free webinar on February 18th from 7 to 8 p.m. And I'll put the registration for that in the chat as well. And that will go into more detail about the changes, what Medicaid is, who is on Medicaid, because some people may not even know that they're on Medicaid because it has a different name. And so we really want people to know that that is where they're getting their health insurance so that if the changes happen, they can stay up to date and we can keep them covered. So that's it.
Thank you so much, Waypoint. Thank you, Liz and Emily, for going through that. We are short on time, so Tara, I'm going to have us skip over the scan slides, but they are there for folks. And I also encourage you to see their website and they can unpack some of these pieces for you. And the reason that I want to have a little bit of time saved is that taking all of this information in is a lot, and I'll be honest, sometimes it's a real bummer, and it is a way of kind of feeling really discouraged of all of these things that might be in limbo, services that might be affected that ultimately impact children and families and the organizations that you all work at. So I kind of wanted to end on like a good news, with the peak being someone wins a summit ticket. So for our colleagues on the call, for folks who are joining us as our audience, if you have good news, things to share with the group, if you can drop those in the chat, Tara will make sure as we follow up with everyone that those resources get shared with our network. And then I ask our panelists, what do we do? I think for me in the space, it was there are things citizens can do to change outcomes, and that is a bit more hopeful than kind of the doom and gloom that I know you all sometimes see every day as you're hearing different effects of different bills. Anything that is like sunshine, rainbows, or hope that keeps you all going in the space.
I can jump in there a little, Nicole, which is one of those bills that we talked about, that I talked about, the 1788. We did a sign-on letter with some colleagues, and when I went to go check to just make sure it showed up where I thought it would, every other sign-in was in opposition. So to see that some of these things that we're concerned about are in the sort of public opinion that we're seeing, sitting in a place where folks are kind of understanding some of the problems with the bills as they're written, I think is uplifting. We are still seeing folks recognize that maybe their feelings about things aren't necessarily being represented. And that's a good sign.
I'll share too. We've been doing some fun social media, and we have been working to try to make things a little bit more accessible. And the other day, House Bill 155, that BET cut bill, had its first hearing, and there were 3 moms there who didn't know what the legislature was, or really advocacy or the process, a year ago, but through relationships and building community, they've sort of like supported each other and gotten the support they need through us and some of our partners to be confident enough to go and do this work. And I mean, these 3 moms were reading these lawmakers the Riot Act last Wednesday. So that is my ray of sunshine. I love that. And I'm going to have Alyssa drop a link in the chat for Moms Rising has a legislature toolkit that you can use with anybody that you work with to help them understand the process of testifying, where to go, where to park, etc.
Yes, and I also, Trina, I hope you'll plug some of the new futures pieces too. So between all of our advocacy colleagues, you can watch on TikTok and Facebook and different places to literally see where to park and how to get to the rooms. They make it super simple. So Trina, I hope I didn't take what you were going to say. Go ahead.
I should add some of those resources, definitely. The positive I was just going to mention is the great thing about my job is I get to see sort of those advocacy wheels turning. And right now we're seeing some new groups build their advocacy voice in the state. And so for one, working with kinship families has been such a pleasure. And to see them build themselves more and more into an advocacy space and to find the issues that are really important to them that they can attack as a group has been a really wonderful experience. So
Thank
that's
you.
my
Thank you
ray of
all.
sunshine.
Oh, thank you. I have to be half full, right? Glass half full, a little Pollyanna, to end our time together. So thank you to our panelists. And Tara, we're a couple minutes behind, but I think we still have time to spin the wheel and see who wins our family summit ticket.
You know we do.
Awesome. Let's see what happens.
All right. Perfect. Let's see. And so again, just as a reminder, the best way to enter these is by making sure you register. And so based on that and based on those that were able to attend today, we have quite a few folks in here. So we're going to spin it. Frankie, are you here?
I am. I'm here.
Yay!
Woohoo!
Congratulations.
Awesome. Yay. Thank you so much for joining. We will reach out to you to make sure that you are added to our list for that summit ticket in the fall.
Awesome.
Yeah, thank you so much for being here. Awesome. Perfect. So I'm not gonna pull up my slides so we can all see each other as we wrap up. Nicole, is there anything else you want to share before I send us off?
Just take care of yourselves, friends. Take care of each other. Let's do good things in the world.